Good morning and welcome to today's New York City Council hearing on the Committee on Civil Service and Labor. At this time, during today's hearing, no one may approach the dais. If you'd like to testify today, please see one of the Sergeant-at-Arms to fill out a testimony slip. Please silence all electronic devices. Chair, you may begin.
Good morning, everyone, and welcome to today's hearing of the New York City Council's Committee on Civil Service and Labor. I'm Councilmember Shirley Aldebol, Chair of this committee. Today we will be considering Introduction 303, sponsored by Councilmember Christopher Marte, which seeks to implement maximum working hours for home care workers. We would like to note that this bill, Intro 303, was previously heard as Intro 175 during a previous Civil Service and Labor Committee hearing on September 6, 2022. The testimony from that hearing will be incorporated by reference in today's hearing testimony for consideration by the committee. Home health care services is a crucial industry with over 130,000 workers providing essential care to older adults and individuals with disabilities in New York City. The presence of a home care worker can mean that an individual who would have been placed in a congregate care facility can instead remain at home, living independently. Home care workers provide a range of services for their clients, including assistance with eating, mobility, and other activities of daily living. Depending on the severity of their needs, recipients of home care may require part-time, intermittent home care services, or they may need more intensive 24-hour live-in care. However, despite the vital work that home care workers perform, this committee has heard time and again that the compensation structure that exists for home care workers in the state is insufficient, and that employees are struggling to make ends meet. In 2025, the mean annual wage for home health and personal care aides was below $41,000 a year, which falls well below the estimated true cost of living in New York City. This cannot be an acceptable status quo for workers who have made serving others their career and who hold the well-being of our city's most vulnerable residents in their hands. As we discuss this legislation, we hope to ensure that the dialogue surrounding this bill focuses on meeting the needs of home care workers and home care recipients. Because while the process for assessing, authorizing, and billing for home care can be complex, our goal is simple: to ensure that individuals who require assistance can receive crucial care without interruption, and that the workers who are dedicated to their clients can be compensated safe, and respected. I'd like to thank committee staff, senior policy analyst Nina Rosenberg, and senior legislative counsel Rie Ogasura. Wait, I messed that up. Rie Ogasurwara for their hard work in preparing for this hearing. I'd also like to thank my Chief of Staff, Sophia Brown, for the work that you do for our constituents. At this point, I would like to recognize that we've been joined by Councilmember Frank Morano. And anybody else? I'll now turn it over to Councilmember Marte for his opening statement.
Thank you, Chair Aldebol, and my colleagues for holding this hearing on Intro 303, the No More 24 Act. To people all around the world, New York City stands as a beacon of workers' rights. But in thousands of homes across this city, immigrant women of color are slaving away in forced 24-hour shifts and only receiving 13 hours of pay. These work days in a row with no sleep, no time to eat, no time to spend with their families, they sacrifice so much more than their health. They're sacrificing their lives. My mom worked 24-hour shifts. When she left for work, it would be days before I saw her again. She would come back exhausted, only able to spend a few hours at home before she had to leave again. These tolls these shifts take on workers meets the United Nations definition of torture. They are human rights violations. The workers in this room with us today are just a fraction of the thousands of home care workers who have been organizing to end the 24-hour workday for almost a decade. 4 years ago, I stood with them when we first introduced this bill. But politics and special interests blocked the legislation from coming to a vote. These workers would not be silenced. They held rally after rally outside of City Hall, each time bringing a bigger and bigger crowd of other home care workers, patients, and patients' families. Also, other workers joined from across industries who recognize that our workdays are getting too long and our working conditions are dragged down so long as the New York City sanctions 24-hour shifts. Their protest culminated in a hunger strike outside of City Hall in the freezing rain. These powerful women whose health had been compromised by the violence of 24-hour shift risked their well-being even further just to have their voices heard. Despite all this opposition, despite the council legislative delay, the home care workers nevertheless made immense progress. Their organizing forced many home care agencies to stop assigning 24-hour shifts and split the care into two 12-hour shifts. They won back hundreds of thousands of dollars of stolen wages from home care agency. Through the efforts of these workers, many of whom are still working 24-hour shifts while fighting for justice, they're already slowly abolishing these inhumane working conditions. I'm proud to be here with my colleagues today to do our part to meet this moment and ensure that these home care workers are no longer fighting alone. Thank you.
Thank you, council member. At this point, I'd like to recognize that we have representatives from DCWP, and I will turn to committee counsel to administer the oath for this panel.
We will now hear testimony from the administration. Before we begin, I will administer the affirmation. Panelists, please raise your right hands. I will read the affirmation once and then call on each of you individually to respond. Do you affirm to tell the truth, the whole truth, and nothing but the truth before this committee and to respond honestly to council member questions? Ms. Wagner.
I do.
Thank you.
Good morning, Chair Aldebol and Councilmember Marte. My name is Carlos Ortiz, and I'm the Deputy Commissioner of External Affairs for the Department of Consumer and Worker Protection. I'm joined by my colleague, Elizabeth Wagner, DCWP's Deputy Commissioner of the Office of Labor Policy and Standards. Thank you for the opportunity to testify today on Instruction 303 relating to maximum working hours for home care aides. The New York City Department of Consumer and Worker Protection is the nation's leading municipal enforcement agency charged with delivering economic justice. DCWP leverages its authority to bring New Yorkers real economic relief and protect them from predatory, deceptive, and unfair practices that violate their rights as consumers and workers. This includes pioneering cutting-edge protections, such as the city's Consumer Protection Law, Protected Time Off Law, Fair Workweek Law, and delivery worker laws. Through licensing more than 45,000 businesses in over 45 industries, DCWP ensures fair competition and a level playing field for responsible small businesses that are integral to New York City's vibrant communities. DCWP also provides essential services such as free tax prep preparation, financial counseling to ensure New Yorkers keep more of what they earn and can plan for their futures. DCWP is committed to making sure New York City is a fair, more affordable place to live. DCWP has been at the forefront of advocating for enhanced protections for paid care workers for nearly a decade. We are home to the city's Paid Care Division, a first-in-the-nation initiative to focus on the needs of low-wage paid care workers. Through the Paid Care Division, DCWP has built relationships with advocates and provider organizations holding annual convenings of workers to help connect them with assistance and educate them about their rights. DCWP has combined outreach, advocacy, and enforcement to uphold and expand the rights of paid care workers in New York City. The Protected Time Off Law, formerly known as the Earned Safe and Sick Time Act, covers paid care workers, including domestic workers and home health workers. During the early months of the pandemic, we partnered with the council to update this law to allow domestic workers to accrue their safe and sick time at the same rate as other workers in New York City. We also advocated for and achieved a private right of action for workers to be able to bring their own cases forward for violations of their rights. Lastly, the Protected Time Off Law newly provides for additional uses of leave, including to care for a child or to attend a legal proceeding. DCWP has proactively used its enforcement authority to go after unlawful workplace activity in the paid care industry. We are currently investigating multiple home health care employers for sick time violations under the Protected Time Off Law. And following our standard procedures in these situations, these are citywide investigations to protect all affected workers. As an example of this practice, last year we resolved a sick time case against Alara Caring for not allowing workers to take time off work as required by law, which resulted in nearly $1 million in restitution and civil penalties to more than 2,200 workers. DCWP also regularly partners with state authorities to identify and investigate complaints related to labor protections outside of our jurisdiction. There are approximately 300,000 home care workers in New York City, providing essential assistance, comfort, and dignity to people in their care, while working long hours and performing emotionally and physically difficult labor out of the public view. Home care workers represent the largest share of the healthcare workforce, made up in large part by immigrant women, oftentimes older adults themselves, being paid only a little more than half of a New York City living wage. Currently, the New York State Department of Labor allows for home care workers to be scheduled for 24-hour shifts. For each 24-hour shift, an employer is permitted to pay the workers for only 13 hours if the worker receives 3 hours for meal breaks and an 8-hour sleep break, 5 hours of which must be uninterrupted sleep. If the worker does not receive these breaks, the worker must be compensated for the entirety of the 24-hour shift. Our understanding is that the majority of home care patients pay for their care through Medicaid reimbursements. That Medicaid funding is directed to health insurance providers or local municipal agencies. These entities contract with local home care providers to employ the home care workers for the patient. And depending on the needs of the patient, a single home care worker could be scheduled for a 24-hour shift, for which the worker will typically only be paid for 13 hours. Introduction 303 would prohibit scheduling home care aides for shifts longer than 12 hours, consecutive 12-hour shifts, or shifts totaling more than 12 hours in a 24-hour period. Except an employer could assign up to 2 additional hours per day or 10 hours per week for limited, unforeseeable circumstances. It would also cap a worker's scheduled hours at 56 hours per week unless the worker gives consent and the employer provides 2 weeks advance notice. DCWP supports the intent of this legislation to improve working conditions and compensation for home health aides. All levels of government must work together to address the exploitation that workers in this essential sector face far too often. Workers should always be paid for all the hours that they work. The practical realities of paid care work make it common for home care workers' sleep and meal periods to be interrupted. Yet, despite New York State DOL requirements, we have heard of some workers not being compensated for the full 24 hours, even when they report sleep and meal interruptions. Many of the workers in this industry are women of color and immigrants who have expressed fears of retaliation, or in fact have experienced retaliation, when they report that their rest periods have been interrupted or that they have not been fairly compensated. This dynamic must be addressed. However, we have concerns that prohibiting 24-hour shifts without additional Medicaid funding to home care providers could have unintended consequences for patients and workers. If home care providers do not receive the funding to properly pay multiple workers to cover an entire day for a home care patient, care could be disrupted and less shifts could be available for workers. Therefore, ensuring home care workers are paid for the hours they work will require a comprehensive response. Stronger enforcement of New York State DOL requirements is essential, as are greater protections for these workers, especially immigrant workers who have expressed fears of reporting violations. Prohibiting 24-hour shifts will require working collaboratively with the state to establish necessary funding streams for implementation. Ultimately, this coordination is vital to being able to address the fundamental issues workers are raising with respect to the exploitation they face in the workplace, particularly around lack of rest and wage theft, as well as improving care conditions for New Yorkers. Once again, I would like to thank the Council for the opportunity to testify in today's legislation and for your commitment to addressing workplace issues that impact New York City's home care workers. DCWP and the administration are committed to continued collaboration with workers, advocates, and policymakers to improve working and care conditions for all New Yorkers, and we look forward to today's discussion and questions.
Sorry, I do have a question. Since the bill was last heard in 2022, it received some amendments, removing the language requiring the 50-hour weekly cap, adding language to implement a 56-hour weekly cap that may be exceeded if the employer provides 2 weeks written notice and obtains consent from the home care employee, and files a record of such excess assignment with the Department of Consumer and Worker Protection. Extending the effective date of the bill to resolve state funding issues, and adding an educational outreach component about the rights that home care workers are entitled to under the law. Do you have any feedback regarding the amended provisions? And do they allay any of the previous concerns that were expressed in the September 6th, 2022 hearing when this bill was last heard?
Thank you, Chair. I would say that these amendments that you've mentioned are certainly improvements on the bill that we're supportive of. I think along the lines of the cap on worker hours, that's something we heard directly from workers and advocates that they were interested in. we're very welcome that the council has taken that feedback in. I think components of outreach are essential for the agency. We are an outreach face forward agency. We make sure that we have relationships with workers directly or with organizations. And then on the state funding piece, I think that is, as I relayed in my testimony, that is a critical piece, I think, of this equation. And I'm thankful that the council is also looking into that as well.
Thank you for being here, and thank you for supporting the intent of the bill. I have a few questions. Has DCWP looked into how many home care agencies in New York City that schedule 24-hour shifts compared to how many already schedule split shifts for 12-hour shifts?
Thank you for the question, Councilmember. We wouldn't have that specific information recorded through complaints or data sets that we have, but in our outreach to advocates in this space and our understanding from providers and employers that there are approximately 300,000 home care workers in the city, and about 10% of them, 8 to 10% of them, are engaged in 24-hour shifts.
Okay. So have you talked to any of the home care agencies who have scheduled 12-hour shifts, especially ones who stop assigning 24-hour shifts?
We have not yet had a chance to engage with those agencies that have been implementing 12-hour shifts. Although I think as part of the legislative process, we welcome the opportunity to speak with stakeholders on this issue to understand more about their how they're making changes to their infrastructures. We have spoken with advocates, but I think this is an ongoing organic conversation that needs to be had to make sure we're getting the best protections we can for workers.
Yeah. So my office has been working with advocates and home care workers, and we've met with a few of the bosses of these home care agencies who have shifted from 24-hour shifts to 12-hour shifts, and they have not brought up any concerns of financial burden. And I know in your testimony you talked about potential increased funding through Medicaid, when we know that almost entirely the 24-hour shift home care agency is funded by that funding stream. Do you have any data to support? Because from our dialogues, these home care agencies have not said they needed more money or to give the 24-hour care.
Thank you, Councilor. I mean, we would greatly appreciate being connected with these agencies. I think as we've done our own research and outreach to nonprofits and other providers across the city, we have heard concerns about funding streams. I think ultimately, to implement protections for workers at this scale, we need to have a multilateral approach that has greater protections for workers, but also make sure that we're working collaboratively with the state on what the city needs from them. But yes, please, I'd welcome being connected with more folks to understand this issue better.
I think that's all the questions that I have for now.
We're joined by Councilmember Tiffany Caban. You have a question?
Yes, thank you. And this is broad, but it does affect the topic at hand. We were briefed on the preliminary budget yesterday with the mayor that was obviously released. So I just would love if you could talk about what's needed in this moment, budget-wise, personnel-wise, to take on bigger, enforcement responsibilities, whether it's this bill or the number of other bills that we passed, like the street vendor reforms, or maybe even bills that we anticipate as a council passing, like the Delivery Protection Act.
Thank you for the question, Councilmember. Currently the agency has been implementing key legislation related to delivery worker minimum pay rate expansion, the protected time off expansion that I referenced in my testimony, self-storage licensing expansion. The fiscal impact statements for those bills that are on the council's website total about 34 new staff lines for implementation. So far, for this preliminary budget, we received approximately 9 staff lines. But I think those conversations with OMB will be ongoing, and I think we will also be having further discussions as we move into the executive budget phase as well.
So I think it's fair to say you need a lot more.
I think we are, in terms of in terms of resources, one, to ensure that we're able to cover the backlog of cases that we have, both on the consumer and worker protection side, and the new mandates that the agency is taking on. Because again, I think these mandates are incredibly important for New Yorkers. The resources conversation is significant, and why we put together those fiscal impact statements too.
And I think, I mean, obviously, we've been able to see the good work that your folks do, most recently with some record-breaking amounts of money coming back to the city, going back to workers who have been denied those funds. So thank you, I appreciate that.
And thank you for elevating that what we've been able to recover for workers. And my colleague Elizabeth Wagner, her and her team have been able to, on just the worker side alone, recover about $67 million in restitution for workers. I think it showcases the efforts of a small but mighty team in delivering real results for New Yorkers, which is core to our mission.
Thank you. Thank you, Chair.
Thank you. Councilmember Morano?
Thank you, Madam Chair. Thank you, Deputy Commissioner, for such thorough testimony, such well-prepared testimony, and thank you for printing out copies for us, which is always helpful in terms of following. I want to follow up on a couple of the questions that Councilmember Marte alluded to. Your testimony states that prohibiting 24-hour shifts without additional Medicaid funding could disrupt care. Has additional Medicaid funding been secured to support this change?
I don't believe that additional Medicaid funding has been thus far secured, but I do take Chair Aldabal's comments too about the amendments to the bill and making sure we're working with the state on that issue. And I think for us as an agency too, it's important that we work collaboratively with the state as well.
If it hasn't, isn't there a risk that providers simply won't be able to comply?
I think for us, we want to make sure that, I mean, that's certainly a concern that we've raised in our testimony, but ultimately, I think we need to get to a place where we are addressing workplace harm, where we're addressing worker violation, worker exploitation that Councilmember Marte has raised. And so, again, a multilateral approach is what's needed there. Not just passing legislation, but also being able to work with the state on the issues that you're raising.
Following up on a couple of the cost points that my colleague Councilmember Caban mentioned, has DCWP calculated the total additional cost to the system if providers must replace one 24-hour worker with two or more workers?
We don't have a cost for that yet, but I think that's an important point to raise for the conversation as well.
And who ultimately, just for clarity's sake, bears that cost? Taxpayers, providers, workers, some combination?
I would just note that under current law, if a patient actually needs 24-hour care, it is already the law that an agency is supposed to provide that level of care. And so while I can't speak to exactly the breakdown of who's funding that, current law does require compensation for all 24 hours.
And I think I would note on that too, as often happens in these cases where meal periods don't happen, rest breaks don't happen, the worker at that point is entitled to fuller compensation under the law as well.
Do we currently have enough trained home care workers in New York City to replace every 24-hour shift with shorter shifts?
I don't think we know the answer to that specific question, but would just also note that there's a variety of different care needs among care recipients, and not every person is actually going to need 24-hour care. So it also makes it difficult to estimate the number you're looking for.
Are there patients who prefer having one caregiver for longer periods rather than multiple different caregivers?
I think that I think that's a valid question, but to some degree, I think the value of the hearing like this is to hear directly from patients and their advocates about what those needs are as well. This is not something that the agency has received direct information on.
Finally, from me, should adult workers have the right to voluntarily choose longer shifts if they prefer to do so?
Only if they're lawfully compensated for the time.
Thank you.
Thank you, Councilmember.
Councilmember Marte?
Just a few more questions. From your understanding of the bill in the industry, there, it's a state-run program, Medicaid. However, 24-hour shifts are almost entirely assigned to New York City, while other parts of the states like Long Island, Rochester, Buffalo issue two 12-hour shifts, what we're trying to achieve. And in some cities like Rochester, they have 3 8-hour shifts. So the funding stream comes from the same source to provide 24-hour care. However, it's just New York City that only pays them for 13 hours of those 24 hours that they work. Furthermore, if a patient requests 24-hour care, there is a process in place now by having a nurse's note and having approval from their home care agency and the insurance company to have 2 12-hour split shifts, which will give proper 24-hour care to that patient. So in theory, right now, you can actually do this, but you have to go through a long process, and it only happens here in New York City. So what we're doing with this bill, we're just ending that long process that many of the patients, because they're vulnerable individuals, and many of these workers, many who don't speak English, are not able to do that process. So I would love to hear your take on that.
No, thank you for the clarification, Councilmember, on the intent of that. And this is a little far afield of the work that we're doing at the agency, but my understanding as well is that the 24-hour shifts, it comes from the directive on that comes from the state and also is managed by municipal agencies too. So I think the point is well taken that there are other municipalities across the state that are engaging in shifts in different ways, and that's I think part of the picture that we all need to realize.
And as I think you said it really well, I just want to reaffirm this point. When a worker can't sleep for 5 hours straight, they can be compensated for those 24 hours of work. So technically the money is there. Technically the money can be granted to this patient. They just have to document that they weren't able to sleep for 5 hours. And sometimes the agency doesn't allow the paperwork to actually document that disruption of rest.
I would respectfully, I would defer to the state on what money is there, but I would reiterate again that workers should be paid for all the time they're working. If they're not getting their meal breaks, if they're not getting rest, they should be paid for that. And I think we as public servants need to make sure that we are facilitating that or enforcing that as diligently as possible.
And my final question, Medicaid funds a lot of doctor visits, a lot of different types of surgery. Under Medicaid, is there any other sector where you see doctors working without being paid for the hours that they work, where you see nurses not being paid for the hours that they work, from your experience in New York City?
I can't speak to those other professions, doctors and nurses. I can say, I think in the paid care realm, there are natural point. There are points that make that work very difficult for workers. The isolation, folks who have predominantly immigrant backgrounds, women of color. These have all contributed to exploitation happening in that industry specifically. And in terms of our enforcement work, it's helped us in terms of guiding our enforcement. We have done audits of the industry, so to speak. We recently had that major case around Alara Caring. We are investigating home care agencies now. And I think it ties back to the fact that there are issues with how workers are treated in that industry.
And I'll end by just saying, just because someone has a PhD, just because someone has a title or certification, doesn't mean they're providing better care than home attendants. All workers should be paid for every single hour that they work. All workers should be respected for the compassion and love that they give to our most vulnerable population. And so I think that's what we're trying to address today, to make sure that all workers have the same representation, the same value in our city. Thank you.
I have an additional question. So, DCWP's paid care division focuses on the needs of paid care workers, including home care workers. In 2024, the paid care division received 12 complaints, opened 20 investigations, and closed 27 investigations. Do you currently have data on what the filed complaints were for? Did they exhibit a pattern that indicated that DCWP should investigate a specific employer or employees, a group of employees? Of the 20 investigations that were opened in 2024, are they still open? The mayor's management report states that in 2024, DCWP received 1,581 total complaints, opened 476 investigations, and closed 387 investigations. Would all investigations probing the home care industry be conducted by the paid care division? Or are there other divisions at DCWP that may incidentally be engaged in oversight of home care workers based on the information provided in the complaint?
So, speaking to our work in this area, most of the complaints that we receive that the paid care division staff handle are against home health care agencies. We also do get some complaints from workers who work in private homes as domestic workers, but the largest area of work is investigations of home health care agencies. And those are paid sick time investigations. So it is a common, unfortunately, fact pattern that workers report that they're disciplined when they call out sick, that they're not paid for sick leave without bringing in a doctor's note. Those practices are not lawful in New York City. We often hear from workers that these are systemic issues that affect all workers in the workplace. And when we learn that, we open up an investigation covering the entire workforce that's potentially affected by an allegation of an unlawful practice. And so we do have several open investigations right now, workplace-wide, class-wide investigations into home health care agencies for practices like that. Those cases can take some time to work up to ensure that we are looking at every angle, making sure that every worker is covered. But that is the bulk of the work that the paid care division does, is enforcement like that.
And do you have a sense of complaints regarding, interrupted sleep or break times, that they're not getting paid the 24 hours?
So we don't track data on those issues because we don't have authority to enforce wage theft laws, and that would be a wage theft issue, an overtime issue like that. And so because we don't have enforcement authority over the New York labor law and overtime, we don't track that data, but all our investigators are trained in issue spotting, other issues that may affect workers that are outside of our jurisdiction, and making sure they get to the right place. And in a case like that, the right place is going to be the Department of Labor, and also potentially private attorneys who would be able to take that case and bring a case for the worker to recover compensation for the 24 hours of unpaid work.
We've been joined by Councilmember Ty Hankerson. Do you have any questions? There are no other questions. I will now open the floor to public testimony. Before we begin, thank you.
Thank you, Chair. And we'll make sure we have our staff monitoring the hearing as well.
Thank you.
Thank you.
Thank you.
Before we begin, I want to remind members of the public that this is a formal government proceeding and that decorum shall be observed at all times. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify, No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant at Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant at Arms and wait for your name to be called. Once you have been recognized, you will have 2 minutes to speak on today's legislation. On Introduction 303. If you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant at Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. When you hear your name, please come up to the witness panel. For the first panel, we invite State Senator Jessica Ramos and Ron Kim. Assemblymember Ron Kim, I'm sorry.
It's the hair.
All right. Buenos dias, Chair Aldeon and members of the Labor Committee. My name is Jessica Ramos. I represent the Queens neighborhoods of Corona, East Elmhurst, Jackson Heights, Elmhurst, and parts of Rego Park and Forest Hills in the New York State Senate. I'm proud to represent one of the most diverse districts in the entire world, home to thousands of workers who provide essential services across all 5 boroughs. I submit this testimony in strong support of Councilmember Marte's No More 24 Act. In New York City, home care agencies routinely assign workers to 24-hour shifts caring for elderly and disabled New Yorkers. Under the state's so-called 13-hour rule, workers are paid for just 13 hours of that shift based on the assumption that they receive uninterrupted sleep and regular meal breaks. But we know that's not reality. Workers have testified for years that sleep is interrupted, meals are skipped, and they remain on call around the clock. This is a labor crisis that's been hiding in plain sight. Well, no more. New York City's home care workforce includes roughly 130,000 workers. About 93% are women, more than 70% are immigrants. These are overwhelmingly women of color who speak Spanish, Creole, Chinese, and many other languages, many of whom are my neighbors. They are performing one of the most physically demanding and emotionally taxing jobs in our economy while being compensated for barely half the time they are required to be present. This is not theoretical for me. When my Aunt Miriam first came to this country from Colombia, she did this work. I saw firsthand how backbreaking it is, the lifting, the constant vigilance, the emotional weight of caring for someone's loved ones while being far away from your own family. These workers are not just performing tasks, they are sustaining human dignity. No one should be expected to do that for 24 hours straight. No other city in New York State assigns 24-hour home care shifts. The No More 24 Act would bring New York in line with the rest of the state, and I urge you to pass this bill. Was that my buzzer? Yes.
Yep, that's your buzzer. Thank you. Oh, it's 2 minutes.
We're not in Albany anymore, Dorothy.
We're a little quicker here in New York
Right.
City.
Well, good morning. My name is Ron Kim. I'm serving my 7th term in the State Assembly. And before my current role as the Chair of Tourism, I chaired the Committee on Aging for 4 years, overseeing the interests of older adults throughout New York. In my role as aging chair, I published a 103-page report on how government contractors trusted to administer home care committed years of wage theft against home care workers. I also held a state oversight hearing comparing home care managed by intermediaries called managed care organizations, MCOs, that set monthly fees to provide necessary services for an enrollee versus fee-for-service home care models administered directly by county governments. Can you guess under which model we have billions of dollars stolen from home care workers? What could possibly go wrong when for-profit intermediaries are financially incentivized to keep care costs at or below the monthly fees for each client? The moment the state hired MCOs for insurance companies to manage our Medicaid-backed home care, we launched a system based on predatory inclusion. It's a system driven by undercutting care while maximizing profits. For 15 years, many chose to look the other way because so many of our institutions became detrimentally reliant on this predatory inclusion system. For example, we know many progressive allies and friends who work for nonprofits that are in contract with MCOs, and we certainly know governors and past mayors who've taken millions from insurance companies, and they played their part to defend MCOs. But throughout this very complex and broken system, we're lucky to have truth tellers like Christopher Marte, the chair, the new speaker, and we're here to tell that truth. But the best and the most effective truth tellers are the home cares standing behind me in the next room. And there are many of those who chose not to speak up because of the cultural sensitivity, because of the cultural pressure to shut up and not speak up. To those people who are not here, we hear you, we understand you, we're continuing to fight, and we're going to end 24-hour work. Thank you.
Thank you. Christopher Marte, thank you, council member.
Thank you both for being here, State Senator Ramos. So simple question. In your testimony, in your written testimony, you say that the infrastructure exists to administer 2 12-hour shifts because it happens in the rest of the state, just not here in New York City. Can you elaborate that a little bit more?
That's correct. As is practice at a state level, according to state law, there is a way for us to divide the work into 2 shifts in one day instead of forcing one person to work 24 hours, especially in exchange for only compensation of essentially those 12 or 13 hours.
Thank you. And
It's wage theft at its best.
and one question for Assemblymember Ron Kim. You released almost a 110-page report talking about the wage theft that was happening here in New York City, mostly to Asian American home care workers. Can you talk a little bit about that report and why it was so groundbreaking?
Yeah, when we examined decades of stolen wages by a nonprofit contractor, we discovered that they've deployed some of the worst tactics that every other giant corporations have deployed against workers, employing some of the biggest law firms to gaslight the public, to make it feel like it's the workers' fault. And within that report, we discovered also the employers threatening workers to lie on their documented, submitted work hours, to tell the state that they did not work 24 hours because they understood in that moment that if they did, it's not Medicaid. It was the employer on record that had to come up with overtime hours. So there's proven documentation that these contractors knew, but they chose to continue the 24-hour work and threaten workers to lie about the hours that they worked. For these crimes, these contractors must be held accountable. And this is, again, it's a complex issue. It's extremely complicated because we have allies and friends who are part of the nonprofit world. And I'm not individualizing any of this. I'm still friends with them. But as institutions, we have to be honest about the mistakes we've made. And we all made mistakes, including the state, including the past governors, legislature who looked the other way, who created the system in the first place. But if we can't be honest about where we are as a system, how can we move forward? And today, this is a step in the right direction to trigger that series of actions to hold to hold institutions accountable, and making sure that we can move forward, ending 24-hour work, but making sure that the intermediaries, the insurance companies, are not the one leading the agenda for the state of New York.
Thank you, Ram. And I think you brought up a really good point that I want to emphasize. Part of the newer bill with the amendments that we made, the worker has to document that they want to work these extra hour shifts. So we're not putting a absolute cap on how many hours they can work. They just have to agree and give consent. And also that has to be reported to Department of Consumer Worker Protection, just to make sure that they don't see a pattern from one home care agency alone where they're getting a lot of exceptions for additional work hours, to make sure that there is some sort of accountability and trust in the system.
That's right. Yeah. Otherwise, these employers will continue to use their tactics to put them in a box where if you speak up, they'll no longer get the hours. And if you don't lie about the hours, they'll target you and not give you the work. So what do you expect the workers who lack English to do? They'll just-
Unionize.
Right. You need to, yeah, they are unionizing. This is the step one, right? So your bill to safeguard them and efforts to unionize will be the next steps to make sure that they have the power.
Thank you, Matt. I'm done.
Councilmember Caban.
Thank you, Chair. Thank you, Senator Ramos and Assemblymember Kim, for being here. And Senator, just wanted to wish you a meaningful beginning to the Lent season. Assemblymember, you talked a little bit about, because obviously this is a complicated problem that requires a lot of action. We have work to do here at the city. There needs to be work done at the state level. It needs to be work done in the NGO space, all of the above. And you alluded to some of the sort of issues at the state level with legislation related with the governor. Can you talk a little bit about also what is being worked on in Albany and what's needed to help fix this problem and make sure that workers are being paid for every hour, that they have dignified, work experiences and environments? Like what is overall needs to be done here?
Yeah, we've done something monumental two budgets ago, I believe, when we included in our one house a fee for service for home care model. In other words, we were going to take Medicaid home care reimbursement power away from MCOs and go back to the fee for service, where we cut out the intermediary middlemen. And for the workers that worked, we will pay you for the hours worked. Other states like Connecticut and many other states, when they face a decision of outsourcing to MCOs, they chose to keep it in-house, and you don't see the kind of wage step that we see in those states that we see now. So that's one long-term solution to get us there. But obviously taking on a multi-billion-dollar industry and convincing Governor Kathy Hochul and leadership to go on board, even though the legislature did that, we didn't make it to the finish line because of the power that the insurance company holds. So that's one. But secondly,
Wait, can I just follow up on that part, and then when you go into the second part, because I think there's also more to flesh out there that would be useful to understand, is like just talking a bit more about the reimbursement issues and like the challenges with the insurance companies.
Yeah, when you set a capitation-based formula payment where they assign a dollar amount for each client, their margins rely on undercutting and delaying the payment, because otherwise, who's going to make up the difference, right? So when you get in a request for split 24 hours, that means that insurance companies have to pay 12 hours, versus when you convince the employer to, hey, take on 24 hours, the burden of paying for overtime no longer is on Medicaid, but it's on the employer to figure out how to pay. So it is a predatory system based on exploiting workers. And I've, just like the senator, have witnessed firsthand when my father passed away, I was begging. After a year and a half fighting cancer, I was on the phone with insurance companies begging for 24 hours. You know when I got that call? Oh, you've been approved? The day after he passed, they call me. Oh, you've been approved for 24 hours after denying it for 3 weeks. So I've lived firsthand how toxic and how predatory the system has been, not only workers, but on the patients as well, Senator.
Well, I mean, from the labor perspective, of course, it's about how pervasive wage theft is in our city and our state, and actually having the mechanisms for workers to be able to recover their lost and stolen wages. Unfortunately, even if the DOL deems a claim to be true, there is no real enforcing of the employer paying back the wages that have been stolen. This is why this very same group of workers has been at the forefront of fighting for SWEAT, which is securing wages earned against theft. We have even introduced versions of it to be included in budgets in session, and yet there's no one to really force these companies to pay out even when they've been found guilty.
Councilmember Morano?
Thank you. Thank you, Senator. Thank you, Assemblyman. And Assemblyman, I've been a great admirer of yours for a long time, and I especially appreciate your leadership on the nursing home issue in the aftermath of and during COVID. So it's great to see you in person. Your testimony focuses heavily on wage theft and exploitation by the MCOs. Would you agree that wage theft is already illegal under existing state and federal law?
Yes, we have some of the strongest, if not the strongest, wage theft. It could be stronger, yeah. It could be stronger. And, on the surface, we have some strong language, but just like everything in modern government, it's the administrative capacity to enforce the laws that we fought so hard for home care workers and other workers.
If the core problem is illegal wage theft, how does limiting shift length address employers who are already violating the law?
I'm sorry, repeat the last part.
So if the core problem is illegal wage theft, which is what your focus on was here, how does limiting shift length, which is in large part what this legislation does, how does that address employers who are already violating the existing law?
Well, there's two separate lanes. One, under the current construct, the burden of enforcing the law, the legal law, is not it's on the state, and we simply do not have enough governmental public capacity to crack down and enforce that law. In fact, oftentimes the Department of Labor, as the senator knows very well, often chooses not to and find gaps to not enforce, which is what's been happening to many of these workers based on what the mandatory collective agreement that sometimes the workers often sign without even knowing they're signing on to it. Even though the federal government came down and said that no, that doesn't matter, you need to still comply with the labor law. New York State Department of Labor has chosen to not enforce some of the law based on collective agreement signing.
So would stronger enforcement of existing wage laws address many of the abuses that you described without restricting worker scheduling flexibility?
Only in part, because what we're aiming to do here is redefine the shift work, right? Right now, 24 hours counts as one shift, but they're only being paid for half of that shift. If you actually define the shift to be 12 hours, which is the state standard, and we can bring New York City into the century, then we can make sure that they are being compensated for the appropriate number of shifts that they have worked. That is one of the many ways that employers skirt paying wages to workers. And we may have lots of laws on the books, but the fact of the matter is district attorneys decide whether to prosecute guilty employers or not, and that's based on the felony that has been created in the penal code by the state Senate and the Assembly a year or two ago. That's largely been only used by DA Bragg, the great district attorney from Manhattan. He's really the only one who's been holding construction contractors accountable. We would love for other district attorneys to explore this. But beyond that, the types of workers that get abused in this way tend to be immigrants, tend to be women, tend to speak very little English, don't have access to representation, right? Even if it's on contingency fees, they don't know where to go to find an attorney who speaks Chinese to represent them in these cases. And then, then even if they are found, the Department of Labor does not have the capacity or ability to force the employer to pay them what they're owed. So it's a broken system to the tune of $3 billion a year that's being siphoned away from the economy of our communities every year because we don't do enough about wage theft.
I think, Councilman, I think you're implying that if they're breaking the law anyway, even if he changes law, like what's
Right.
that's happening? I think it's a different dynamic when it's illegal to work 24 hours versus right now it's not. So they're finding ways to do it and not pay for workers. I think if you make it clear, I think the level of enforcement will be greater on them.
Sorry, I'll add very quickly. This is the same issue with correction officers. I carry the bill to do away with their third mandatory shift. Right now, correction officers sleep in their car and have a high rate of divorce because they're being forced to work extra hours, even though they shouldn't be, and it's not healthy for them or for the person who is incarcerated.
Thank you.
Thank you.
Okay, thank you, Senator Ramos and
Thank you.
Assemblymember Kim. Okay, so I'm going to call up the next panel. When you hear your name, please come up to the witness panel. We invite Stephen B. Auerbach, Vittoria Fariello, Belinda Hu, Sarah Shapiro, and Sio Moed. Mr. Auerbach, when you're ready.
Thank you for inviting me. My name's Dr. Steve Auerbach. I'm a retired physician and public health doctor here in New York City, and I'm representing two groups today in support of No More 24. In support of No More 24, both the New York Doctors Coalition, recently renamed Health Justice for New York, and Physicians for a National Health Program, New York Metro. We've endorsed the No More 24 campaign for years. We're the groups that also supported the hunger strikers. Let me start by saying that from a moral and biomedical perspective, in no workplace in America should a 24-hour shift ever be considered acceptable, not for the health of the worker and not for the quality of the work as the human body tires. As physicians, we know that as a person tires, our ability to maintain full attention, quality of decision-making, care to detail, and physical strength are all reduced. So the caregiver cannot be giving their best care to the patient, and it's harmful for both the mental and physical health of the caregiver and the client. Regardless of any court ruling, it is absurd and obscene that an employer is allowed to control where an employed person's body is located for a 24-hour shift and then pay for only 13 hours. Now, it's claimed that these shifts are being made more acceptable under the court's ostensibly ruling that 3 hours are for meal breaks and 8 hours are for designated rest, of which 5 hours it should be for uninterrupted sleep. And I'm going to be as polite as I can in this setting, but that's bullshit. The whole point of the 24-hour shift is that the person needs to have continuous care, continuous attention paid. It's why everywhere else the standard of care is for 2 caregivers working 12-hour shifts, awake and alert the whole time, 3 caregivers to work 8 hours. It's simply self-contradictory to say 11 hours off and then require them to be there for 24. And if I may, I know my time's up. Let me just briefly make the point. The whole point of that 5 hours continuous sleep is nonsense, because if the person needs care during that sleep, either they're not going to get the care they need or the person's going to be woken. So the entire legal ruling is based on a self-contradictory lie. So I will leave it there, and thank you for your time.
Thank you.
Thank you. Good morning. Yes, it is morning. Good morning, Chairwoman and members of the City Council and members of the public. Thank you for allowing me the opportunity to be here to speak. My name is Victoria Fariello. I am a Democratic District Leader here in Lower Manhattan. And I came to urge every council member to sign on to and pass the Intro 303, the No More 24 bill. For years, home attendant workers have marched, rallied, and protested the inhumane practice of 24-hour shifts. They have held hunger strike where home attendant workers, including women in their late 60s, demanded an end to the 24-hour workday. Even though some of them no longer worked these shifts or no longer worked, they did not want to see others have to bear this same burden. The use of 24-hour shifts has led to countless home attendant workers to leave the job. It is a job retention issue as well as a deterrent to bringing on more workers. While advocating for workers, I personally encountered 3 individual women who told me they left their jobs because of the 24-hour shifts, and they were untenable for them. And they were not part of the protest. They happened to be walking by. So only a few home care agencies still require the 24-hour shifts, while many others have settled lawsuits with workers and no longer assign 24-hour shifts. These agencies still operate, which shows that it can be done without hurting their bottom line. We need to recognize that when funding for agencies is what prevents support for this bill, we are actually saying that the financial burden must be carried by the home attendant workers, as we have heard from Chairwoman who noted that they make about $40,000 a year. So we're asking them to carry an additional burden. So to CM Morano's point,
Please conclude your remarks.
sorry, thank you. So no one wins when our home attendant workers are overworked, exhausted, and abused. So I strongly urge all of you to sign on to this bill. Thank you.
Thank you.
Hi, my name is Sarah Shapiro. I'm a municipal retiree representing the Cross Union Retirees Organizing Committee, known as CROC. We are a group of New York City retirees from various municipal unions who have stood beside the home care attendants since before the hunger strike of March 2024. We have rallied and marched with primarily these immigrant women, and we have many similarities with them. Although the home care attendants are more vulnerable as they are primarily immigrant women of color. We also both had legislation in the City Council introduced by Council Member Christopher Marte and blocked by the previous speaker, who said that the issue for the home care attendants was a state issue, not a city issue, even though most home care attendants in New York State were not forced to work 24-hour shifts. They say that home care workers can probably sleep during the unpaid time, which is not true if you must turn your patient every 2 hours to avoid bed sores or accompany them to the bathroom in the middle of the night. These 24-hour shifts not only affect the workers' quality of life, giving them very little family time, but also their health is affected long after they can no longer work. It also affects the patients who are not getting the quality care they deserve and need. CROC believes that health care is a human right and everyone deserves comprehensive and guaranteed health care, and we need to fix the broken system of for-profit healthcare insurance companies. So that's why we support the New York Health Act. These 24-hour shifts are exploitative, abusive, and unjust. CROC stands against slavery, which was abolished in 1865. We also stand against wage theft, and we stand with these workers who need to get the justice and dignity that they deserve. So we are advocating for Speaker Menon to do the right thing, bring Intro 303 to the floor for a vote. It's time to pass the No More 24 Act. Thank you very much.
Thank you.
Thank you. My name is Belinda, and I'm a young worker living in New York City, and I'm an organizer with the A9 Women Campaign. I am honored to testify in support of the No More 24 Act. Around the time I had learned about the home care workers' fight to end the 24-hour workday, I had just left my last office job where I was regularly working until 10, 11, 12, sometimes even 2 a.m. I'd regularly skip going to the bathroom or put off meals because I was so overworked, and I became deeply burnt out in the fall of 2023, right when the genocide in Gaza had started. How could it be that everyone I knew was so overworked, being grinded to dust at our jobs, just for our wages to be sent overseas to kill people? It doesn't make sense. Through organizing alongside home care workers, it has become clear to me. The 24-hour workday is a perfect manifestation of the world that we live in, where our bodies and our lives are viewed as expendable by our jobs, where we have no control over our time or where our money goes. It's a world where workers like me are scared to speak out against these grave injustices for fear of being fired or retaliated against, and it is a world where all working people's health is being destroyed. I don't want to live in this type of world anymore. Seeing home care workers bravely unite with their community to fight back against their bosses, go on hunger strike, picket in front of the Department of Labor, has shown me that we can reclaim our lives. As long as a 24-hour workday exists for home care workers, it sets the precedent that any worker, like you or me, could be forced into these types of exploitative conditions. Ending the 24-hour workday is the first step to building a world that all of us deserve to live in. Please pass Intro 303. Thank you very much.
Thank you.
Thank you, City College. I went to City College. I kept saying that. Thank you, City Council, for this opportunity to participate in democracy and justice for all. I'm C.O. Moed. I'm a native New Yorker, a writer. And when my mother Florence got sick, my sister and I were beneficiaries of the crappy working conditions sleep-in Medicaid home attendants endured. And after Florence died, I was mortified to find out that the home attendants were working 84 hours straight, but only getting paid for 42. So let's cut to the chase, because I only got 2 minutes. How many of you here have cleaned the anus and genitals of your parents, spouse, adult children? Because I have, mother and father. Who here would clean the genitals and anus of a stranger and also do the cooking, cleaning, laundry, shopping, feeding for 24 hours straight, 72 hours straight, 84 hours straight? Clearly, whoever made the policy that home attendants weren't really working at night have never worked around the clock. Can you imagine telling someone it was sleepy time, not work time, and that the diaper would get changed in the morning? Now, I had to take care of my dad around the clock for 3 days, and I was barely functioning afterwards. I mean, I didn't have to do it year in and year out, but my mom's home attendants were doing 84 hours straight, week after week, away from their family and their home, and that's inhumane. Like, it leaves the attendant exhausted, isolated, separated from what so many of us take for granted, to get to sleep in our own bed at night. So I spoke to home attendants, and they said working 24 hours straight ruined their health, hurt their families. You couldn't pay them enough to do that kind of work again. The monks who walked for peace from Texas to D.C. urged us to treat one another with compassion. You, City Council, with its new speaker, you can make this happen for the amazing home attendants by giving them humane 12-hour shifts so they can sleep in their own bed at night. Thank you very much. Oh, 4 seconds to go. Yes.
Thank you very much for your testimony today. Thank you. I'm going to call up the next panel. When you hear your name, please come up to the witness panel. Japneet Singh, Ji Nan Lin, Shark Quinzov, Lin Zhen Zi, Zhu Zhen. Oh, they're coming from the old phone. Okay. They may be in the overflow room. Mhm. Yeah.
I think a few people signed on but aren't speaking by accident just because they
Oh,
thought it was a
okay.
sign-in sheet.
Well, there are people in other rooms, so let's give them a minute to respond. Okay. One more time. Japneet Singh, Ji Nan Lin, Jacques Gwyn Zov, Lin Zin Zi, Zhu Shen. Have a seat. Huh? Okay, they were in the other room. Okay. We have an interpreter? Okay. Okay, thank you. Okay. Please begin.
大家好，Happy New Year！我是郑秀春，是个护理员。今天我来发言是支持马太提出301法案，接受24小时工作率。24工作率我做了9年，每周3到4天，照顾病人的是焦虑症。后来卧床，整天需要我换尿布，我的床安在他旁边，从早到晚上一举一动都要看着。刚刚睡下又要叫起来，我的工作很辛苦，因为万一把病人摔得很危险。我们护理就是这样没日没夜的工作，自己的身体越成了病人，得了心脏病，因为经常肩膀顶住病人，保护他安全，我患上了肩周炎，现在睡眠也随着断断续续。我站出来反对24小时工作率，不是为了我自己，而是为了这个社会下一代。24工作率是暴力，是反对还人类，哪里都不应该有的。所以我支持废除24小时。我们是很辛苦的工作，希望有关部门支持这项工作，废除24小时，把我们该还的钱赔我们。谢谢。
I'm translating for her. Hello, everyone. My name is Zheng Xiuchen, and I am a caregiver and a home care worker. I'm here today to speak in support of Councilmember Christopher Marte's Bill 303 to end the 24-hour workday. I worked 24-hour shifts for 9 years, 3 to 4 days a week. I cared for a patient who suffered from anxiety and later became bedbound, needing diaper changes all day long. My bed was placed in the patient's room. I had to watch her every move from morning to night. I would just lie down and have to get up again immediately. We had to be very careful because if the patient fell, it would be very dangerous. Working day and night without rest, I became a patient myself and developed heart disease. Because I often used my shoulders and brace the patient to keep her safe, I developed a frozen shoulder. Even now that I am retired, my sleep is still fragmented. I am standing up against the 24-hour workday, not just for myself, but for the next generation of this society. The 24-hour workday is violence. It is against humanity, and it should not exist anywhere. Thank you, and I wish everyone a Happy New Year.
Thank you.
Hello. Good morning, Chair and the members of the Council. My name is Japneet Singh, and I'm here today in support of the Intro 303. First, I want to acknowledge what this moment represents. After years of organizing and advocacy, we are finally having this hearing. That only happened because workers refused to be silent. But let's be honest, we should have never waited this long. 24-hour shifts are not humane. They are not safe, and they're not worthy of a city that claims to stand for justice. For me, this is personal. I watched my own mother endure these conditions. I've seen the exhaustion in her eyes. I've seen how much strength it takes just to survive a system that demands everything from you while giving so little back. As a Sikh, I was raised with the principles of seva, selfless service, and sarbat bala, the well-being of all people. Our faith teaches us that dignity is not optional, it is fundamental. When someone serves the vulnerable, they deserve protection, respect, and fairness in return. New York proudly calls itself a sanctuary city. We speak loudly about defending immigrants, but how can we advocate for immigrants on the national stage while our own city allows immigrant women to be exploited through 24-hour workdays? We cannot claim to protect immigrant communities while benefiting from their exhaustion. A hearing is not justice, passing the bill is. The council has an opportunity to correct the years of harm and stand on the side of dignity. I urge you to pass the No More 24 Act and finally end 24-hour workdays. Thank you so much.
Thank you.
Hey, 大家好，我叫陈雪珍，是康怡公司的护理员。24小时工作，我做了10年，通常每周做3天。晚上2-3个小时要陪着病人起来上洗手间、喝水。每次上班我都要带3天的菜饭，吃饭的时候同时也要照顾病人。令我吃饭的时候断断续续、匆匆忙忙，肠胃都做坏了。我向公司填表报告，没有持续5个小时的睡眠，也没有3个小时的吃饭。公司恐吓我，你要按要求填，不填的话你就没得做。长期24小时的工作，导致我睡眠障碍和肠胃不适。我支持马太议员提出的303号法案，结束24小时工作日。谢谢。
I'm translating. Hello, everyone. My name is Xuezhen Chen. I am a home care worker with Royal Home Care Agency. I worked 24-hour shifts for 10 years, usually 3 consecutive days each week. During the night, I had to assist patients to use the bathroom every 2 or 3 hours. Every time I went to work, I had to bring 3 days' worth of meals. Even when eating, I still had to care for the patient at the same time. So my meals were always interrupted or rushed. This severely damaged my stomach and digestive health. I reported on agency forms that I did not receive 5 continuous hours of uninterrupted sleep. The agency threatened me, saying that if I did not indicate that I had 5 hours of sleep, I would not be given work. Working 24-hour shifts for so many years has caused me sleep disorders and serious gastrointestinal problems. I support City Council Christopher Marte's Bill 303 to end the 24-hour workday. Thank you.
Thank you for your testimony today. Thank you. Calling up the next panel, Zhang Xiu Chen, Carlos Herrera, Zhu Nijun, Kinley, Zhu Fenjin. Missing. Okay. Yes. Okay. Would you state your name in the beginning of the testimony to make sure we have everybody? Okay. Yeah. Excuse me? Yes. No, I'm gonna turn on the mic.
Okay, thank you. 大家好，新年好，我是陈丽，我的名字我是一名护理员，我今天出来讲话是支持马太议员提出这个303号法案，结束24小时工作日。我在嘉惠和优秀护理公司工作了5、6年，通常每周连续6天，每晚上1-2小时起来给病人换药片、翻身，根本就没有那个5个小时的睡觉，做了5、6年，所以我的心脏手术、胆管切除、脚动了2次手术。所以医生说你赶快要停掉，不停掉你的身体就垮了，不能再工作了，你还要不要命啊？我后来害怕了，5、6年下来，我停止了24小时工作日，医生说不能熬夜，我恨透了这个24小时，我害怕。也把我害惨了。24小时真的不是人做的，一定要停止这个24小时。谢谢啊。
Hello, I'm translating. Hello, everyone. Happy New Year. My name is Li Chen. I'm a home care worker. I'm speaking here today in support of City Council Member Chris Marte's Bill 303 to end the 24-hour workday. I worked 24-hour shifts for 5 to 6 years at home care agencies such as Prestige and Great Care. I usually worked 6 consecutive days each week. During the night, every 1 to 2 hours, I had to change the patient's diapers and turn the patient's body. After doing this for 5 to 6 years, my body collapsed. I had heart surgery, bile duct removal surgery, and surgery on my leg. My doctor told me that if I wanted to survive, I had to immediately stop working 24-hour shifts and stop staying up all night. I hate the 24-hour workday. It has harmed me so badly. The 24-hour shift is inhumane. It must be stopped. Thank you. Oh, that's it.
Oh, you're going to testify?
No, I'm just translating.
You're just translating. Okay.
Oh, wait. If I'm testifying, should I testify now as well, or? I did the thing to testify.
You did not sign to testify?
I did sign to testify.
You did?
Should I
Okay.
testify right now?
Yeah. What's your name, please?
Okay, cool. My name is Aaron. That's unexpected. Cool. My name is Aaron. I'm a Queens resident and a young worker. I'm here to proudly testify in support of the No More 24 Act. When I learned about the fight to end the 24-hour workday, I was working in finance. I was killing myself. I was working through my lunch break and into the night. I was vomiting every morning. And I didn't do anything about my time and health being stolen because I thought that it was the best that I could get. These home care workers taught me how to stand up for myself. Imagine what they have been told. You don't speak English. You're not educated. As an immigrant woman, you should be so lucky to get to slave away. And every New Yorker knows that it's terrifying to stand up at your job. And yet these fearless women have not only stood up to their shameless bosses, they have brought their fights from the insurance companies to union offices. They've gone all the way up to the United Nations. They've united with their patients and their community, and they've led workers like me to fight alongside them. I have seen with my own eyes how the fight to end 24-hour shifts resonates across race and trade, across workers of all income levels. I know tech workers who wake up in the middle of the night to fix a bug. I have friends who have worked themselves into the hospital, and then their parents can't even visit them because they're also too busy at work. We're all told that our health and our time are not worth anything, and nowhere is this more blatant than in the 24-hour workday. The 24-hour workday is a stain on New York City. What does it say to all workers if we continue to allow this modern day slavery? It is past time to end it. So I am a transformed person because of the fight to end the 24-hour workday. And it is thanks to the leadership of these women home care workers that I know that my time and my health cannot be bought. We need to end the 24-hour workday. Please pass Intro 303. Thank you very much.
Thank you. What's your name again? Your full name?
Aaron Liu, Aaronliu.
Thank you. You may start.
Hello, good morning, everyone. My name is Carlos Herrera. I am a currently a restaurant worker. I have worked many different jobs. I have been exploited, discriminated. My health problems don't come from 24-hour shifts, but they come from similar racist attacks on my health. I am a victim of workplace assault because I am an immigrant worker. In all my jobs, they have stolen my wages, and I never have control over my time because I have to work. Wherever my bosses say, no matter how many hours per day or days per week. I have been inspired from home care workers, how they come together, how they speak up about the bad conditions of 24 hours workday shifts. They can spend time with their families. They lost their health. If we eliminate the 24 hours workday shifts, that will encourage other workers like restaurant workers to come forward to improve our working condition. So that's why I'm here organizing with home attendants to eliminate 24 hours workday shifts. I urge you to pass the No More 24 Act 303. No more 24. No more 24.
Thank you.
OK， 尊敬的市议长，各位朋友，我叫李晴，是一名护理员。仅此中国马年新春佳节，祝大家新年快乐 ，Happy New Year！ 今天我在此讲述24小时不人道的工作制。10年前，我的工作是全天24小时在病人家里照顾病人，工资 money 只有13个小时，另外11个小时我同样要留在病人家里照顾病人，每周工作连续3天。更可怕的是 ，my family 没办法照顾到女儿高中时期升学，家庭开放日我都不能够参加。丈夫工作结束了，不理孩子，我的家庭他也离开了我的家庭，然后导致婚姻破裂。4年前，我继续支持市议员马泰先生的法案，已经来过市府多次 ，more come here。可恶的是，该法案一直被前议长欧德斯stop， 让成千上万的妇女工人备受煎熬至今。今天我再次来到这里，支持马泰先生的303法案，恳请市议会通过，这将会大大鼓励我们辛勤工作的护理员。谢谢大家。
I'm here to translate.
Thank you.
Honorable Council Speaker, dear friends, my name is Li Qing, and I am a home care worker. On the occasion of the Chinese New Year, the Year of the Horse, I wish everyone a happy and prosperous New Year. Today, I am here to speak out about the inhumanity of the 24-hour workday. 10 years ago, my job was to care for a patient in their home for 24 hours a day. I was only paid for 13 hours of work, but for the other 11 hours, I remained in the patient home providing care, working 3 consecutive days at a time. Even worse, I was unable to take care of my own family. I couldn't attend my daughter's high school orientations or family open day. After my husband finished work, he wouldn't look after our child and left the family on his own, which led to the breakdown of our marriage. 4 years ago, I supported Councilmember Christopher Marte's bill and have come to City Hall many times since then. What is despicable is that the bill has been blocked by former Council Speaker Adrian Adams, causing tens of thousands of women workers to suffer endlessly until now. Today, I am here again to support Councilmember Marte's Bill 303. I earnestly urge the City Council to pass it. This would be a tremendous encouragement to us, the hardworking home care workers. Thank you, everyone.
Thank you, everyone, for your testimony. Okay, please come to the witness table when your name is called. Yun Fang Zhang, Zhu Wenyang, Ying Na Ruan, Liu Li Ying, Chan Lei Yi Chan. Please make sure that you state your name. Thank you.
大家好，我叫妮娜张，我是护理员。我今天发言是支持马泰议员提出的303法案，结束24小时工作日法案。24小时工作日我做了7、8年，我通常每周连续做5天，照顾痴呆的病人。夜晚要协助病人用洗手间5、6次，根本没得睡。我这样没夜的工作，把身体都搞垮了，经常头痛、腰痛、膝盖痛、失眠，自己的家里的事情根本顾不上了。24小时工作日必须立刻停止。Thank you.
I'm translating for her. Hello, my name is Lina Zhang, and I'm a home care worker. I'm here today to support City Council member Christopher Marte's Bill 303, the No More 24 Act. I have been working 24-hour shifts for 7 or 8 years now. I usually work 5 consecutive days a week, caring for patients with dementia. At night, I have to assist them when using the restroom 5 or 6 times, so I get virtually no sleep. This round-the-clock work has ruined my health. I frequently suffer from headaches, back pain, knee pain, and insomnia. I also can't take care of things at home at all. The 24-hour workday must be stopped immediately, past the No More 24 Act.
我是张云花，大家努力新年快乐！今天新年开门红，我们护理姐妹相聚在这里，支持马太议员303法案，结束24小时工作日。我做24小时工作超过了10年，做到我睡眠、手肩痛、肩膀痛，多少钱买不 不毁我的健康。可是，旧议长欧德斯只手遮天，千方百计阻挡法案通过，继续压迫妇女，伤害我们的健康，破坏我们的家庭。我们共有团结一致，动员全纽约市团体和社区反对他暴力和独裁，让他去年市长选举大败，只拿到10%的选票。大家都同意，纽约市不应该有24小时工作，除旧迎新。现在是新的一届议会，他再也阻挡不了我们前进的，真是大快人心。我们感谢新的议长朱曼玲给我们的机会作证，发出我们的声音，呼吁所有的市议员跟我们妇女和广大社区站在一起，支持马太议员303法案，结束24小时工作率 ，No more 24 ，No more 24。
Happy Lunar New Year, everyone. This is a good beginning of New Year for us, because we home attendants are gathering here today to support City Council member Chris Martin's Bill 303 and end 24-hour workday. I did 24-hour workday for more than 10 years. It costs my sleep, gives me chronic pain, and takes away my health that no money can buy it back. The previous City Council Speaker, Adrienne Adams, however, tried everything she can to block the bill, continue to exploit us, hurt us, and break our families. We home attendants united and mobilized communities across New York City to oppose her violent dictatorship, making her lose very ugly in the last mayoral race, only 4% of votes. And why is that? Because everybody agrees there should be no 24-hour workday in New York City. As we enter the new year, we discard the old and embrace the new. The new City Council will no longer stop us marching forward. What a victory for us. We thank the new Council Speaker Manning giving us a chance to testify. And we call on all City Council members to stand with us immigrant workers. Support Bill 303. Stop the 24-hour workday. No more 24.
Thank you. What? May I have your name, please? May I have her name?
Yunfang Zhang.
Okay. Okay, next panel, when you hear your name, please come to the table, to the panel. Lucy Estrella, David Eisenbach, Leila Law Gisoko, Sabrina Fang, Shirley Rands. No? Okay, please begin.
Comienzo. Buena tarde. Mi nombre es Luz Estrella. Trabajé por 12 años, turno de 24 horas, a United Youth Council. Soy miembro de la 1199. Aquí estamos aquí 24 horas. Estamos aquí para que los turnos de 24 horas sean divididos en 12 y 12. Me afectaron mi salud física y mentalmente. Por la noche no podía dormir bien. No podía dormir. Sufro de presión alta y ahora tengo que estar tomando medicina. Trabajé por 24 horas y nunca pude estar con mi familia. Mis hijos enfermaban muy grave. No podía estar con ellos. Tenía que durar 4 días, 24 horas. Llamaba a la agencia para que me mandaran, nunca me mandaron una sustituta. Tenía que aguantar ahí 24 horas, 4 días. Me disculpan que no sé de letra mucho, difícil. Estos momentos recordados son muy dolorosos para mí, porque no podía estar haciendo el trabajo con mis hijos cuando enfermaban como madre. Tenía miedo, mucho miedo si dormía con los trabajadores porque tenía miedo de que le pasara algo y no podía. Ay, no. Es que no sé mucho de letra, no sé de letra. Pero necesitamos que los turnos de 24 horas sean divididos en 2 y que para que haga más trabajo para nosotras las mujeres, porque ya las mujeres no quieren trabajar 24 horas porque es muy triste eso. Y perdónenme y agradecida con todos ustedes y con Chris Marte, que esperamos que lo dividan los turnos de 24 horas.
Thank you. Gracias.
I will provide a translation. Hello, my name is Luz Estrella. I'm a home attendant. I work 12 years, 24-hour shifts for the agency United Jewish Council. I'm part of 1199. We are here because we need to end the 24-hour shifts and divide them into 12. I support Chris Marte's bill 303. 24-hour shifts seriously affected my mental and physical health. At night, I can't sleep well. I suffer from stress, high blood pressure, and depression, and have to take medication. Working 24-hour shifts, I wasn't able to be there for my family. When my kids were sick, I wasn't there for them. One time, when my son was very sick, the agency wouldn't send a replacement, and I had to stay on my 24-hour shift for 4 days. It is a very hard, painful moment to remember because I couldn't fulfill my duties as a mother. I don't work 24-hour shifts now, only 12. It's much better for me because I can be with my family more and sleep at home. I also can give better care to my patients as I am clearer mind and have more energy. In my experience, speaking with other home attendants, many are of the same mind. We don't want to work 24-hour shifts anymore. I urge you to pass the No More 24 Act to end 24-hour workdays. Thank you.
Thank you.
Hi, everybody. I'm Sabrina. I'm a master's student studying here in New York City, and I support passing the No More 24 Act. I chose to come here for what I believe are this city's culture and values. New York has some of the best worker and immigrant protections on the books, and yet it is the only place where immigrant women of color workers are forced to do 24-hour shifts. Enabling these brutal, inhumane working conditions in a city that the whole world looks towards to lead by example says that anybody in any job should be forced to work around the clock. I'm talking about my dad, a software engineer who's on call every other week and sleeps overnight at the office. He turned 60 this year. I'm talking about my friends, freelance artists, who overwork and irreparably injure themselves because they need to make rent. I'm talking about every student who pulls all-nighters and for the good grades to finish their essays and doesn't want to be doing that for the rest of their life. Every student wants a good job. For many of us, that means the one where we get paid the most. We are brainwashed into sacrificing our time, our health, and our morals to make more. If we don't wake up and demand better working conditions, all of us will suffer in this race to the bottom. I have learned more from the home care workers in this room and the next than I ever have in a classroom. The home care workers' fight is my fight, and the fight of every other college student graduating into today's brutal job market. Stop this racist exploitation and pass the No More 24 Act. Thank you.
My name is Shirley Rands, and I'm here to represent myself, my personal experience, as well as National Organization for Women, New York State. As a result of needing home care for both my mother and father, I learned of the appalling working conditions and wages of home attendants for those covered by Medicaid. I was shocked to learn that when my father was added to the case, thereby doubling the home attendants' workload, their salary was increased by 50 cents an hour, twice the work for 50 cents. When my mother's condition deteriorated, she qualified for 24-hour coverage. I was informed that instead of 2 12-hour shifts, it would be 1 24-hour shift, of which only 13 hours would be paid. In other words, they had to work an additional 12 hours a day for 0 wages. I thought about the lack of sleep, not getting paid, and wondered what quality of care such exploitation would result in. I couldn't be a party to this injustice. I declined the service. When my father's condition required multiple diaper changes and repositioning every 12 hours during the night, I again applied for an additional 12-hour shift. The managed long-term care company would only provide one aide to work the entire 24 hours. Despite a letter from his doctor explaining the need for 2 12-hour shifts, they refused. His bed sores worsened and he risked infections. I appealed the ruling of the managed long-term care company. It went up the ladder of denials of the appeals, and then I requested a state hearing. One day before the hearing was scheduled, the company changed their minds and approved the 2 12-hour shifts. It was a Pyrrhic victory. My father died the next day. Besides being a labor issue, this is clearly a woman's issue. Because most of these workers are immigrants, minority women, they are easy to exploit. If this was a job done mainly by white men, such conditions would not have been tolerated. As a lifelong activist and former chapter president in Now New York State, I launched the Now New York State Domestic Workers Task Force, and they became a member of the AIW Coalition. We are committed to ending this modern-day wage slavery.
Thank you. Councilmember Marte has a question.
I have a quick question for Luz, and Sabina, if you can translate, that would be great. So you work for UJC, who historically has done 24-hour shift. But once you started organizing with other workers, as of last year, they've stopped issuing new 24-hour shifts and actually do split 12-hour shifts. And it seems to be that people still get the care that they need, right?
Digo que usted en trabajando para la agencia, en usted haciendo su la lucha, dejaron de darle 24 y le dieron los 12. Y eso es algo que es bueno. And what was the question?
Just to affirm that because she organized, they stopped doing the 24-hour shift, but now they do 2 12-hour shifts to make sure that the patient still gets care.
Claro que sí, porque así yo puedo compartir mucho con mis hijos y puedo estar practicando con mis hijos sabiendo lo que hacen en la casa. Porque cuando trabajaba las 24 horas se me enfermaban grave, muy grave, y yo no podía estar ahí. Llamaba a la agencia y me decían no había nadie. Y tenía que aguantar 4 días y 3 días. Y hasta que no pasara eso, porque tenía miedo, no podía ni dormir. Porque si un cliente se moría, yo sentía, me llevan presa y ahí sí. Sí, tenía mucho miedo, temor, por eso no dormía.
Pero ahora tú trabajas 12 horas.
12 horas
Ajá.
y comparto, entro 8 de la mañana, salgo a 8 de la noche, comparto con mis hijos, duermo en mi casa. Sí,
Está
muy
heavy.
bueno y se ve muy bien eso.
Gracias.
Gracias a ustedes. Y un honor porque he tenido conversaciones con gente importante. Necesito que Dios le dé mucha salud a todito y que puedan llegar más allá arriba con la ayuda de Dios.
Gracias.
And to translate, she is also in agreement with Chris's statement that in working the 12-hour shift, it was a lot better for her because going back to her previous testimony, she was able to spend time with her family. She clocks in at 8, leaves at 8 a.m., leaves at 8 p.m. She can split and share the workload with her coworkers, and she can provide better care for the patients as well. Yes.
Thank you for your testimony, everyone. We're up to panel 6. So please come up when I call your name. Lily Randall, Casey Robinson, Ann Coachman, Glennie Brookt.
My name is Lily, and I'm a member of Youth Against Sweatshops. I am testifying in support of the No More 24 Act. An actor by trade, I am no stranger to long hours, low pay, and frequent uncompensated labor. When I testified in the hearing for this bill 3.5 years ago, I was working 3 part-time jobs and barely scraping by. The 24-hour workday is not an issue isolated to the home care industry. It is a dangerous precedent that sabotages working conditions for all of us. Young workers today are forced to compete for sweatshop jobs or risk facing unprecedented levels of under or unemployment. And the 24-hour workday is the shameful blueprint for all of our bosses to make us work longer and longer hours, steal our wages, health, and labor, and delude us into believing that we should be grateful to have a job at all. 2 years ago, alongside 24 elderly women of color home attendants, I went on hunger strike outside City Hall for 6 days in the hopes that the former Speaker, Adrian Adams, would stop blocking this bill and allow the council to vote on it. Home care workers in one of the most isolated industries came together from across the city, putting their bodies on the line during the coldest week of winter, and united thousands of working people across trade, race, and generation around the fight for our health. Under their leadership, working people now all agree that this brutal practice must end. Workers' organizing has left many agencies with no choice but to split shifts and pay back the wages that they stole. Despite fear-mongering over a funding crisis, none has arisen. This shows that agencies continuing to assign 24-hour shifts do so not because of a financial obstacle, but because they choose to prioritize their own profits over the well-being of the care workers and the patients.
Please conclude your testimony.
Last year, we presented to the United Nations, who also agree that the 24-hour workday is a violation of human rights law. The world is watching as 24-hour modern-day slavery is allowed to fester in New York City. It is time for New York to be a world leader not in exploitation, but in caring for its workers. I strongly urge the Council to vote to pass Intro 303 to finally end the 24-hour workday and bring justice to home care workers and all working people. Thank you.
Thank you.
I am Casey Robinson, testifying in support of Intro 303. I have a master's degree in South Asian Studies from Cornell University and am currently unemployed. I have been organizing with the Ain't I a Woman campaign for 2 years out of necessity. I'm not a home care worker, and yet I've been fighting to end the 24-hour workday, not out of charity, but for myself. Ending the 24-hour workday is not just a home care worker issue. The abuses here in control of time are reflective of every other workplace. Home care workers prove that no matter how hard you work, workers will never receive the benefits. Bosses will make billions while we overwork ourselves. I thought I was a failure and did not have a job because I was not working hard enough. I did not question that friends were overworking themselves, doing mandatory overtime and competing with AI at jobs offering low wages and no benefits. Home care workers taught me the forces at play and a strategy for addressing the lack of worker protections which harm everyone. All bosses in every industry take advantage of these lack of protections to overwork us and offer nothing in return. It is openly carried out in the home care industry, which forces women of color to work 24-hour shifts. But so long as these conditions exist in New York City, it will in turn drag down all our conditions. Every boss knows the rules of the game and makes billions of dollars from the blood, sweat, and deaths of working people. We need to pass Intro 303 not only to end this abhorrent practice that exists only in New York City, but also to send the message to all working people that we can win back our time from our bosses and defeat employers who are overworking us and stealing our wages.
Hi, my name is Ann Kochman, and I'm going to be reading the statement by Richard Gottfried, former Assembly member and Health Committee Chair. I support City Council Intro 303 by Councilmember Marte to limit the hours, thank you, a home health aide may work in a shift, in consecutive shifts, or in a week. Among other things, it would end the concept of a 24-hour shift for home care aides. I commend Council Speaker Julie Menon for signing on in support of the bill. I also call on Governor Hochul, the State Labor Department, and the State Health Department to do all they can to achieve this goal. Until I retired from the Assembly at the end of 2022, I chaired the Assembly Health Committee for 35 years. I worked extensively on efforts to protect home health aides and their patients. Home health aide work is very difficult and stressful. Long hours are a serious burden on the worker, increase the danger of injury to the worker, and increase the danger of injury or other harm to the patient. A 24-hour shift should not be allowed. One problem with a 24-hour shift is the state regulation allowing aides to be paid for only 13 hours of a 24-hour shift. The rationale for the 13-hour rule is that for several hours, the worker is entitled to sleep and take time for meals. However, the worker must be prepared to immediately attend to the patient at any time needed, and of course must remain at the workplace. In practice, they often must attend to the patient during what should be a meal and sleep break, and are often not paid when they lose meal and sleep time. I believe that if a worker is required to be at the workplace and be ready to resume work at a moment's notice, then the worker should be paid for that whole time. It is not enough to just end the 13-hour rule. A 24-hour shift is inherently an excessive burden on a home health aide. Many home care patients do need 24-hour care. My mother did years ago. But that is commonly and quite satisfactorily provided, as in my mother's case, by what is called split shift care, with coverage being divided into two 12-hour shifts by separate workers.
Please wrap up your testimony. Thank you.
An important reason why home care aides need legal protection of maximum hours is that they are low-wage workers with little real power to resist an employer's insistence on excessive hours. When an aide declines an excessive assignment, the aide is often denied other assignments or is cut off entirely by the home care agency. We need action by the governor and her administration and by the city council. Thank you.
Thank you for your testimony today. Please come up when you hear your name. Lee Chen, Juana Valentin, Suli Lee, Cindy Duran. Oh. Jiheng Song. Okay. Okay, you can bring her up when she comes back. Yeah. Oh. I think she. Okay. What is your name? Okay.
I'm here on behalf of the home care workers that worked with my mom. My mom received 24-hour care, and it was very agonizing. My mom had dementia, and sometimes she would call me and she'll tell me, you know, the ladies gotta sleep. You know, who's gonna change me? Who's gonna do anything for me? And for years, she had 24 hours. So I know in firsthand how agonizing it is. The ladies would call me and tell me, your mother needs more hours. Your mother needs to shift. This is not right. You know, she has to. You know, she would move around, but she would be waking them up. They wouldn't sleep. And also they were always like attentive, very attentive. I was very lucky to get great care from my mom. She passed away 3 years ago. But you know, my mother lived a long life because of home care workers, you know, and thank God she lived longer. Once I supported the workers, and they were able to split the shift, and she lived longer, you know, and there was a time where she had to go to a nursing home. Oh my goodness, you know, it was terrible. She had bed sores in the nursing home, and thank God my mother had that great care at home, you know, and I support, you know, that no more 24 hours, because they don't really get to sleep. You're worried about in the middle of the night, worried about your patient. You know, you're in the middle of the night just listening. If they make a noise, you got to run to see if they're okay. You know, and so I'm here to support the no more 24 hour.
Thank you.
Mi nombre es Juana Valentín. Trabajé un año en el 2028. Llegué aquí a la ciudad de Nueva York. No tenía nadie. Vine con mi hijo aquí. Comencé a trabajar de home attendant. Iba a trabajar 2 días, 3 días. De ahí tenía que trabajar, quedarme ahí trabajando, asistir a los pacientes. Cuando trabajé ahí, desarrollé hoy en día depresión. Con la señora Lucy me sentí muy mal. Porque por un poco pierdo a mi hijo porque me lo quitan. Perdón. Desarrollé una depresión. Yo nunca había trabajado eso y como no me sé el idioma tenía que salir adelante. Y comencé a trabajar, veía muchos pacientes que pasaban muchas cosas. La agencia me decían, usted nada más tiene que descansar 11 horas, pero ¿cómo dejo a un paciente tirado? Eso es inhumano, yo dejarlo así. Yo tenía que seguir. Pero cuando salía de ahí, salía irritada. A veces mi hijo me decía que tenía que cuidarlo con 4 años. Le dijo en la escuela que yo le gritaba porque no me dejaba dormir. Y en la escuela me llamaron para decirme que si yo no cambiaba mi forma, me iban a llamar a la protección de los menores y tuve después, vivía en un cuarto y de ese cuarto tuve que irme porque vivía peleando con todo el mundo, me sentí irritada, desarrolló una depresión que hoy todavía tomo un medicamento, caí en el hospital. Todo eso fue después de eso, porque yo no podía dormir. Por favor, ya no más 24 horas. Todavía siguen los abusos, pero ustedes son la ley, ustedes pueden hacerlo.
Gracias. Thank you.
I didn't really catch her full name, so I'm going to summarize what she said. Her name is Juana Valentina. She spoke about how she felt very emotional hearing Luz's testimony because she relates to it. Coming to the country, she didn't know the language, so to make ends meet, she worked these shifts, and it's taxing. She has developed depression for it, and she takes medication. And in working these shifts and being away from her family, she had issues with the school and her child and threatening her if she doesn't change how her availability to be with her child, that they would call child services, and she fears having her kids taken away. It's very emotional. She feels very angry at the city, at the system, and she wants to end the shift. She supports the act of No More 24. Thank you.
Thank you.
我的名字是李淑丽，我是一个家庭护理员。我从事24小时工作日有7、8年了。我照顾的病人，他患有帕金森糖尿病和痴呆症，四肢都不能自主活动的长期卧床。我们的工作规程是每2个小时要给他翻身换尿布的，24小时内都是这样的。慢慢的，就是因为太紧张了，我就变得心不舒服了，经常莫名其妙的跳得很快很快。后来我就不得不去看心脏科医生，医生就给我开药，我现在都是靠吃那个心脏药，每天才维持现在正常的心脏跳动。我恨死了24小时工作制，因为我作为护理员，我很有责任心，我上了班我就要照顾他好嘛，所以就太紧张了。我的丈夫他也是24小时的护理员，所以呢，我们很少在家里能见到，所以呢，家就不成家了。加上工作紧张，休息回到家什么也不想干了，家里也是乱糟糟的，所以这几年也没做24小时了。就是24小时工作日太不人道了，太残酷了，它伤害了我的健康，破坏了我的家庭。No more 24 hours.
Thank you.
I'm translating for her. I'm Li Su Li, a home care worker. I've been working 24-hour shifts for 8 years. The patients I take care of are bedridden patients with dementia and Parkinson's disease or diabetes who can't move. Work procedures require that I turn them over and change their diapers for long-term bedridden patients every 2 hours. At first, my patient had 2 12-hour shifts and I was the day shift. But in 2016, the company forced change to 24-hour shifts for 3 consecutive days. Since then, I haven't been able to sleep well. I can't eat, my blood sugar is high, my blood fat and blood pressure have gradually gone up, and my heartbeat is abnormal. I have to see a cardiologist. Now I rely on taking medicine every day to maintain a normal life. I hate the 24-hour workday. My husband also does 24-hour shifts. This work arrangement will lead to our family's failure, and my husband and I spend very little time together every week. There is no warmth in this family life. The 24-hour workday harms my health and destroys my family. It is inhumane, destructive, and violent. It's insane. It should not continue to exist in this society. So I support Bill 303 to end the 24-hour workday. No more 24.
Thank you.
Hello. Hi, my name is Ji He Song, but I am going to be reading the testimony of my friend Maggie Martinez, who isn't able to be here today due to a family medical emergency. Okay, this is my story. I was caring for my mother, and we were in the long-awaited process of waiting for split shifts. I was caring for her 24 hours, and I had only a few hours of help during the day on the weekends. I was taking care of her 24 hours a day, and it was during those 24 hours that my mother fell down right in front of me and broke her hip because I was beyond exhausted and had fallen asleep standing next to her. She ended up for months in the hospital and in a rehabilitation center, and it was there when the agency tried to push the 24-hour shift onto us, and we had to obtain a lawyer to turn it into split shifts. It took months, and during that process, we could not keep the current home attendant because they did not want to work 24-hour shifts, and the agency also had a very difficult time finding anyone that would accept doing a 24-hour shift. So I was back to taking care of my mother 24 hours a day until the court case was finally resolved 4 months later, and we finally got our split shifts. Doing 24 hours greatly put a toll on me and my body and on my mother. For many years, women have been asking our government for fair pay and better work hours. The system has failed our most vulnerable group, and if we had already abolished 24-hour shifts, my mother would be alive because that accident was the beginning of her decline. Home care workers are the only group of women who have been excluded from fair labor laws. It is racist and disgraceful. No more 24.
Thank you. Thank you all for your testimony. Christopher Leon Johnson. Yeah. Please.
Ready?
Yep.
Yeah. Hello, my name is Christopher Leon Johnson. I support this bill, Marte's bill, but Mrs. Chair, you need to be on the record and disclose that you were an executive board member of 32BJ SCIU, which is a sister organization to 1199 SCIU. So you'll be hell bent on making sure that behind the scenes that this bill does not get on the floor to the point this bill dying on the floor. And many of these members of the city council, including the one that sat here over there, Ty Hankerson, is nothing but a R.G. Adams clone who will not support this bill. I want to make this clear that, look, the people going through slavery with this 24-hour workday, and the big problem is that we have a city council that is so hell-bent on making sure that they get reelected like you, Ms. Shirley Abedal, in 2029, because you know that if this bill passes on the floor, you're going to be voted out like Marjorie Velasquez and Christy Marmorato. So I think this bill is a great bill, but this bill's not getting on the floor because of you. You're the main person that's going to be in the way. But I commend you for doing this because at least you did it, unlike Carmen De La Rosa that refused to put this bill on the floor when the last term, because Carmen was so cucked to the unions, she didn't want to put us on the floor. But I feel that you're going to do the same thing and being a shill to the unions because you're so concerned about being reelected in 2029. You know that bills like this will be political suicide for you. It'll be campaign suicide for you in 2029. But I support this bill 100%. I support Chris Marte, but these people need to start calling this stuff out with this situation with the 24-hour workday. And with CPC, the reason they don't want this because the reason they're scared because they don't want to look like Minnesota when it comes to the fraud that's going on in Minnesota. They scared being exposed, be called C Quality Layering Center. That's what they scared be exposed by. But you, Miss Shirley Abadal, need to be on the record saying that you're gonna do whatever you gotta do behind the scenes to kill this bill and make sure this does get on the floor. You're nothing but another Lynn Shulman. You're nothing but the female Dermot Smith, a union hack. So that's all you are. And like I said, a union hack and a union shill, this bill deserves to go through, but you're not gonna let it go through. Thank you so much. Enjoy your day.
Thank you for your testimony. I want to thank everyone who came here to share your thoughts and experiences today. If there is anyone in the chamber who wishes to speak but has not yet had the opportunity to do so, please raise your hand and fill out an appearance card with the Sergeant at Arms. Can you give us your name, please?
Eileen Brooks.
Thank you.
Hello, everyone.
Am I to start? Yes, you may start. Thank you.
Sorry. My name is Eileen Brooks. I live in Queens, Jamaica. I work as a home health aide caregiver for 5 years with Ellison Home Care. When I work 24-hour shift for 5 years, 5 days in a row, 1 week on and 1 week off. They told me I need to clock in at 9 o'clock Friday morning and clock out at 10 o'clock during the night. I work straight for 7 days, which amount to 168 hours for the week. There was no aid that come to relieve me during that 7-day period. I work until the next Friday morning. And I was told that under no circumstances was I allowed to leave the patient, even if I run short of basic commodities or necessities. I had to do without it. During the night after I clock out, the patient still need my help. I has to take them to the bathroom or even clean them up in bed.
Ma'am, please
I
conclude
was
your
the
testimony.
only one that is there with the patient at night. And that mean the patient still need my help during the night. And it deprived me of my sleep almost 100%. How cruel and inhumane these conditions were. And to make things worse, I wasn't even paid for the night hours. I was only paid for 13 hours a day.
Thank you.
I don't finish as yet.
Give you a few
But
more
because
seconds.
workers fight back, and my new agency now stop doing 24 hours, and now we do this split 12 and 12. another agent come in and relieve me, and then I could get to go home. So I can go home and sleep and go back to work in the morning. That is why that is why, but we only can rely on but we cannot rely on the agency to split the shift when so many are making huge profit by continuing to steal workers' wages through this 24-hour shift. That is why I urge all honorable council members to vote to pass this bill and end this cruel practice of 24-hour shift and give us workers back our life. Thank you so much.
Thank you. Do we have anyone on Zoom who's going to testify? Oh, Bianca. Okay, I'm going to make a final call for anyone who hasn't had the opportunity to testify, who signed up to testify. Okay. And then making a final call for Zoom registrants who have not yet spoken. I have one person. Bianca Sui Davies.
You may begin.
Thank you. Good afternoon, all. My name is Bianca Sue Davis, and I'm a hospice social worker. Firstly, I want to acknowledge what home health aides do. The feeding, bathing, toileting, dressing, turning, and repositioning to prevent bed sores, keeping a watchful eye to prevent falls, not to mention the socialization and the love that they provide to alleviate isolation and loneliness. Because of them, my patients have lived longer, happier, and healthier lives. As we've heard, when a worker works a full 24-hour shift, they're only paid for 13 of those hours. Also, as mentioned, the alternate option does already exist, where one aide works 12 hours during the day and another at night. It's just very difficult to get approved, as Assemblymember Kim experienced firsthand. Managed long-term care plans will reject patients' continuous requests for 12 and 12 split shift care. They justify the 12-hour shift by claiming that workers have 8 hours of sleep and 3 one-hour meal breaks. Yet, a patient's restlessness and agitation, which prevents workers from sleeping or leaving a patient's bedside, is not a reason that they will approve split shift care. And when you're a home health aide, you can't just leave your patient unattended to go meet your friend for lunch. Safety and falls prevention is also not a reason that they will approve split shift care. Even though we all know that safety and falls prevention is crucial to patient health outcomes. It's been suggested to me that a glass of water and a snack should just be left at a patient's bedside overnight, when the patients were too weak to even lift their arms and reach for anything because she was in the final days of her life. I could give you hundreds of more examples, but our time is limited. The point is, as long as this law is in effect, making workers work full 24-hour shifts, Medicaid and insurance companies will take full advantage of it. Do not give them this option. City Council, if we allow this to continue, we are supporting and enabling abuse, discrimination, and stolen wages. Thank you.
Thank you. If you are currently on Zoom and wish to speak but have not had the opportunity to do so, please use the raise hand function, and our staff will unmute you. No one else on Zoom? No one else. Okay. Seeing no hands, I would like to note that everyone can submit written testimony to testimony@council.nyc.gov within 72 hours of this hearing. We thank the administration and the public for attending this hearing to share their thoughts on the legislation, and we look forward to following up on these issues. With that, this hearing is now adjourned. Thank you.